Record. Okay, everybody. So welcome to our annual session on how to prepare for an interview. So I just want to start off with sharing a message, which is that the interview is, when you get to an interview, it is the most critical part of the interview process, without a doubt. Once when you've gotten an interview, you've gotten past the application, you've gotten past the personal statement, letters of recommendation, all those things. Essentially, you've gotten past all those things, and it's your interview which really gives you the opportunity to distinguish yourself from the other applicants. So once when you have your foot in the door for an interview, it is imperative that you take full advantage to distinguish yourself, okay? And the goal for today is to talk about how to prepare for an interview so as to maximize that opportunity. So when you get an interview, you have to hit a home run, okay? You have to. The good news is that it is not too hard to get a home run, all right? It isn't. There was one gentleman, I want to say 2 years ago now, at the Medina Clinic. He only got one interview, and he matched. And so it is possible. You just need to take full advantage of that opportunity. And again, we want to talk about how to prepare for that. Now, the other thing is that when it comes to interviews, a lot of times you'll hear people say, well, you can't really prepare for it. You just show up and do your best and things like that. And I personally don't subscribe to that. Now we're all different, okay? We have our different personalities. Maybe for some people that's true. I can share with you, if I think of personally, that's not true. I know there are some things I can do to prepare in order to have a better outcome, all right? And that goes for everything, by the way, not just an interview. That goes for clinic, that goes for any clinical work. That just goes for almost anything. You know, if you can prepare appropriately, excellent chance you'll have a better outcome. So that's what we want to do, is to talk about how to prep to maximize your outcome. So, any questions so far? No? Okay. All right. So I can tell you personally, you know, when I'll share with you that I went through the match. It was a good 18 years ago, actually, 18 years ago. So, and yeah, I was really what they call a noob. You guys know what a noob is? You guys know what that is? Yeah, I was very young, not a lot of life experience and things like that. You know, almost like an adolescent, practically. And I was an IMG as well, and I wasn't that impressive on paper. Okay, I really wasn't. And so the first time I really got an edge in the application process was the interview. Actually, I'll share with you, my dad actually shared some just some materials on how to interview. So I took it, and then I prepped, okay? And I prepped hard for these interviews. And this is essentially a product of that time. And I've used this approach to prepping ever since, for every single job I've had since then, except for the ones that were really easy. But for every major position that was, you have a lot at stake, I used this approach to prepare for them. And I've just found it really helpful. My sister, she applied for residency a couple years ago. I actually directed her to my video, not my videos, the Medina Clinic's videos. I directed her to it. She found it very helpful. It helped her match. You know, so I just think that I think that it can be a useful technique. So that's what we want to go over today, basically. Okay. All right. So as far as the outline, we're going to talk. This seems like a heavy agenda, but it's not really, as we go through it. So the first thing, the number one question that, you know, residencies are trying to answer when they interview you, okay, We're going to talk about that. What is the number one thing that residencies are trying to figure out when they interview you? What does a successful interview look like? Okay, we'll go over that. The importance of nonverbal communication. Really, if half, if not more, of all your communication is nonverbal. And that goes in any situation, whether it's in clinic or a meeting or an interview, your nonverbal communication speaks volumes. So don't underestimate that. Okay, always have questions. We'll talk about that. Everything is an interview. We'll address what that means. Sleep well the night before, that's fine. Off the wall questions, that's a kind of a quickie that we'll do at the end. And then we'll talk about some etiquettes for the interview, which frankly, you guys may have better information on than I, but we'll address that as well. Is there anything else on here that someone would like to address that is not? No? Okay, all right. Well, let's move on. Okay, guys, what is the number one question residencies are trying to answer when they interview you? Who can tell us? The number one question, the most important thing when they interview you, what are they trying to, what question are they trying to answer? Now, some of you guys did this last year, so you should know.
Why you?
What's that?
Like why they should take you?
Why they should take you. More specific.
Are you a great fit to our program or not?
Yes, who said that?
Humaira.
Oh, we've got a couple. Okay, Dr. Humaira and Dr. Sartak. Now, guys, I want you to know that we are recording this session. The past 2 years, the Medina Clinic has posted these annual sessions on YouTube, primarily for the benefit of the current assistant physicians, especially the new ones. Or current at the time. So just FYI, just so you know that we would like to post this session on YouTube. Okay, so just FYI. All right. Okay, now Dr. Humaira, what was your answer?
They just basically want to see, so we are good on paper when we get the interview, but when we actually go for the interview, they want to see whether we fit well in their program with the residents and the attendings.
Beautiful. That's exactly it. They are trying to determine, are you a good fit for their program? It's not, are you going to be the best doctor ever? It's not going to be, are you the best researcher? Do you have the best bedside manner? I mean, all those things are great. Okay. But really, what they want is, are you a good fit for our program? Okay, that is what they're trying to answer. So just keep that in mind when preparing. Okay. Everything else is important, but the number one question is, are you a good fit for our program, our residents, our faculty? So good job, Dr. Humaira. That's exactly right. Okay, so what does a successful interview look like? All right, there are a couple aspects to this. Okay, the one thing that I would share is, who should do more talking, you or the interviewer? So if you're a fly on the wall, looking at an interview in action, who should be doing most of the talking for a successful interview?
I think it should be a reasonably equal dialogue, in my opinion.
Yeah, reasonably equal is very reasonable. I think that's very reasonable. Absolutely. And why is that, Dr. Sartak? Why should it be roughly equal?
I do believe that should be the case because, of course, the interviewer will ask questions, and the interviewer will respond. But at the same time, it should be in a way that the question answer eventually gets converted into a dialogue or a discussion or a conversation instead of just questions from one side. And then eventually, of course, when we get as candidates get the option to ask questions, we would ask questions about the program or the overall culture. So the and this is my experience from being on both sides of the table, but on my previous work experiences when I was probably on the interviewing side, that some parts of interviews are common across the board, no matter what kind of a job or a position you're interviewing for. which is why I believe that a healthy discussion, of course, initiated with a couple of questions from the interviewer, eventually transitions into a discussion or more of a conversation where both parties try to understand and know each other better, is what a good, healthy interview should look like to a fly on a wall. Just my thoughts.
Yeah, yeah, yeah. Excellent, excellent points, Dr. Sartak. Wonderful.
I want to add.
Yes, please.
So I actually think it should be the interviewer to talk more. When you answer, I think your answer should be a little bit more concise and straightforward. It will give them more time to ask you more questions, so you can, get to answer more about yourself. That's just what I think.
Excellent point, Dr. Atoro. Anybody else? One more person? What do you think?
Yeah, I think also the interviewers should be more talking because they are the one who wanted to, recruit their new member, and they wanted to know more about us than we wanted to, tell them more about us.
Mhm.
So they should be asking more questions to us, and our answers should be precise and short.
Yeah, let me share my perspective. I think if you are someone who has a ton of experience, okay, if you're let's say I work in healthcare administration. Dr. Sartak works in healthcare administration, actually. I think if you have a lot of experience where you're not a beginner in the field, I think then you have a lot to say, okay? You've got a lot of background and knowledge, and I mean, you've got a lot of very well-formed opinions. And I think that is a situation where the interviewee can take up a little bit more airtime. I think if it's a situation where, like, if I think of myself 18 years ago where I didn't know anything about anything, okay, and, just a beginner and, don't really have that maturity level, yeah, you probably don't want to talk too much. you probably want to keep it straight to the point. And I think that could be a difference. So if you are like just starting in this field, it's your first career, the person who's interviewing you has just an overwhelming amount of seniority compared to you. That's a scenario I feel where you really want the interviewer to do more of the talking. As you progress in your career and you have more experience, more insight and background and well-formed thoughts, that's a situation where it becomes a little bit more even and you're able to carry on, more of a 50-50 discussion. Regardless, I think the interviewee should not dominate the interview, okay? If the interviewee dominates the interview and just does the vast majority of the talking and takes up the vast majority of the airtime, that's probably a sign of trouble, okay? So what do you guys think about that? Actually, I remember during one session, it was probably 2 years ago, I was like, yeah, the more experience you have, the more things you have to say. And I think one of the APs got offended. You could watch the video. He was offended. He was like, no, I have a lot to say. I'm like, I'm sure you do, but I'm just saying, I just think let the interviewer do most of the talking. It's just my opinion.
No, Dr. Murad, that's a great perspective. And as much as I'm sure we all are learning, and even I'm learning, and although I have, as I said, you said I have some experience, a few years, if not decades, in healthcare administration, where I've been on both sides of the table, an interviewer and an interviewee at some point of time. It is a very sound insight that you shared, that the interviewee cannot have a huge chunk of the airtime. Absolutely. And my point of view that I had shared just a few minutes ago, that maybe an even discussion or close to a 50-50 conversation could be in selective cases, as you said, if the interviewee is extremely experienced or already a few years down in their career. But for purely the residency point of view, as we all are here for that main goal, I definitely believe that your point of view is like share good things, best things, but also give more airtime to the interviewer, the director, whoever it is, to make sure they are leading the ones, and it's not, it doesn't come off wrong that the interviewee is speaking the most. So
Yeah. No, thank you, Dr. Sartak. I appreciate it. It's very, very kind of you. I think also the more questions that they can ask, probably the better. You want them to ask, because then they can
Absolutely.
find out more about you. That's actually something else that has not come up in previous sessions. So,
Thank you,
and
sir.
I'm sorry, Dr. Sartak, I actually cut you off. I apologize. I didn't mean to.
No, you're good. No, absolutely no. I'm hoping I did not cut you off, but thank you
Oh, no,
for
no.
your insight. Absolutely.
No, thank you. Now, the other thing about the succinct answers is that the attendings, they take presentations from residents all day long. Okay, so let's say I'm being interviewed. I will share that I have a tendency to ramble if I'm not careful. Actually, that's why I prep. Actually, it's to prevent from rambling. Anyway, so if I ramble, then my interviewer will think, my goodness, this guy's going to present to me. This is not going to work. He won't stop talking, and he's not getting to the point, and this won't work. So it's almost like they can see you presenting a patient to them one day. All right, so that's one item. And then let's okay, so we're a fly on the wall. We're seeing that the interviewee is not dominating the time, is giving concise, succinct, impactful answers. Okay, succinct, short, high impact answers. And the other thing that we're seeing is that the interviewee is demonstrating excellent nonverbal communication, which is key. Okay, so let's talk about the aspects of the nonverbal communication. So, look, I think this is actually a little bit uncomfortable at times, to be honest, and maybe with Zoom it's a little better. But basically, here's the deal. Let's say it's an interview in person. If it's in person and I'm sitting in a chair across from my interviewer, I am sitting up, I am looking that person in the eye, and I am smiling at all times. Okay? So did anybody see the movie Smile by chance? Good. It was a scary movie. Okay. So yeah, so if nobody watched it, then there's nothing to talk about from there. So anyway, you smile and you look them in the eye the whole time, all right? And you keep your back up straight, you're sitting up straight. Eye contact is very important. Now, I think, like, depending on what culture you grew up in, like personally, I was not taught to look people in the eye continuously, okay? But do it. All right, do it, because what happens is that it shows that you're engaged, and it's fine, okay? But it shows that you're present, you're engaged, you're engaging. All right, so good posture, look at them in the eye, and you're smiling. You're doing that when your interviewer is talking, as well as when you are delivering your answers. So that posture is that positive nonverbal communication that you are giving. So that's why you actually don't have to talk that much, because nonverbal communication is a large part of your overall communication, actually. So when you are not talking, that nonverbal communication shines through. So then the question is, okay, well, if it's by Zoom, what are you looking at? Who wants to suggest? What are you looking at if it's by Zoom? When you're delivering your answers, you're smiling, you have good posture, but what are you looking at when you're on Zoom? Anybody know?
The camera.
The camera, exactly. You look at the camera. So that should make it easier, okay? if looking people in the eye makes you uncomfortable. But yeah, look at the camera. Don't look at yourself on the screen if you can help it. Look at the camera, and just like and just pretend you're looking at someone in the eye then, and then deliver your answers. All right. So that is the nonverbal communication that you want to give. And of course, you're dressed professionally. That goes without saying. All right. So those are your main aspects to the nonverbal communication that you must demonstrate during an interview. All right. No slouching, no getting distracted, and you better smile. Like, you better smile. It's very important, because that actually is part of professionalism. Part of professionalism is being pleasant when you're tired. It's being pleasant when you are annoyed, okay? It's being pleasant when you are angry, all right? That is part of professionalism. So that smile is critical, all right? Okay. Any questions on that, or any comments, or anybody want to disagree? Feel free to. Anybody? So everybody here has interviewed, all right? What is you guys' experience as far as nonverbal communication, or like, what does this ring true to you, or what?
I totally agree. Being that it's going to be virtual, it's challenging, because looking at that camera light, it's because I want to like make the eye contact, and for me, I'm looking at you on the screen, but then I have to remember that I'm looking actually at the camera.
Right.
I think maybe the green light on your computer might give you, a little bit of a direction. Just look at the green light.
Right. Look at the green light. Exactly.
Yeah. And for the slouching is very true, because I slouch and I tend to like sit like this, and I'm trying to sit up and then smile.
Yeah, absolutely. And what's interesting is that you actually could record yourself. Honestly.
Right.
If somebody wanted to practice, you could turn on Zoom, record yourself, and play it back if you wanted to. I mean, there's a lot of things you can do. To practice that.
Dr. Murad, this is Dr. Sarthak, and I do believe in some ways the virtual interviews are just a little bit challenging. I'm not sure if challenging is the right word, but since you have to try to present the interpersonal touch through literally through a computer screen. As what Dr. Itoro said, that making sure that you are actually focusing at the camera or on the screen, and you inadvertently do not slouch, because if you're in person in a real interview, it is so much, you are literally in the physical presence of a person, and your overall state of mind is completely different. Here, you're still in your home. Maybe you're in a secluded room, you've closed down and told everyone inside your home, don't come. But still, you are still physically and mentally in certain ways in your comfort zone, in your safe space, which might make you vulnerable to kind of slouching, as what Dr. Itoro said, or accidentally, you may not even realize it. And your input that, try recording yourself either by yourself or with friends and playing back each other. I think that's when you will see, oh wow, I did this and I never even realized it. So that's definitely something that worth trying. I would totally try that for sure, no matter how many times you interview another. Looking at yourself and your own recording, you might learn something that you may not know while you're just talking casually, so for sure.
Absolutely. I'll tell you a funny story. One time, I remember there was this one residency interview. They right before the interview, they're like, oh, here, have some chocolate. They try and butter you up. So here, have some chocolate. So they gave me some Hershey Kisses. So I had some Hershey Kisses. So I was like holding, I was like, oh yeah, thanks. And then I go in for the interview and I sit down. So anybody want to guess what happened?
I remember the story. It melted.
Did I tell you the story? I told you the story. It started melting during the interview. It was like melting in my hand. And like she's asking these questions, but I maintained eye contact, people. I just want to say, I had my posture, I smiled, I looked at her straight in the eyes the whole time. And actually, it was good to mentally tell myself, like, this is what I'm going to do, because, you know, otherwise I would have the melting chocolate. I might interrupt the interview and say, I'm sorry, I need to do something. And it may not have been necessary, actually. So no, so
That's a funny story. I was almost going to come up with, my thought came to my mind that you probably quickly had a bite of the chocolate and some of it stuck.
Yeah.
No, before you walked into the room, I'm guessing. Yeah. And I didn't understand. And maybe some of it stuck onto your teeth or something, and then you had to try to clear it out. But yeah, with melting in your hand is equally hilarious. But it's glad to know that you kept your composure at that time.
Yes, kept it. So that's the thing. So yeah, and it's interesting, you know. There are some pros and cons to being in person and being remote, for sure. Yeah, well, good. All right, guys. So that is, if there are no other comments, that's nonverbal communication. All right. So now let's talk about the actual preparation. Okay. So here is what I suggest, how I suggest to anybody to prepare for a residency interview. Okay. The first thing is come up with the 10 interview questions you think they're going to ask you. This is the least difficult part. You know what they're going to ask you. It is not hard. And actually, you've all been through interviews before. You know what they asked you. And probably not many of those questions were a surprise. There are some questions you must prep for, like, tell me about yourself, why this program, strengths and weaknesses, and why this specialty. I mean, that's like 5 right there. Come up with at least 10, all right? So it doesn't need to be, I think more than 15 is too much, all right? But come up with 10. And the most common questions, but then you've got those key ones that you absolutely must have an answer for. Tell me about yourself, strengths and weaknesses, why this program, why this specialty. You must be ready for those questions, all right? And then think of 5 other ones that are, you know, that they think that you believe that they're likely to ask you. So come up with that list, all right? The next thing that you want to do is you want to then come up with anywhere from 2 to 5 bullet points. Maybe just think of 3 bullet points, and those bullet points are going to be answers to your questions, all right? And for each question, think of 3 bullet points. Now, those bullet points, you do not memorize word for word. You just memorize the general idea. You study the general idea, all right? And if you do that for each question, it just takes up a page. That's all it is. It's just a page. It's one side of one piece of paper. You can have 10 questions and 3 bullet points, and each bullet point is just a few words. It's just like a phrase, and that is just the general idea of that point. And you study those points for each question. I remember the night before each interview, it took me roughly about an hour and 15 minutes from beginning to end, all right? So it's an hour and 15 minutes. It's just one side of a piece of paper, and you just study that, all right? The benefit of doing that is, 1, you have your talking points in your mind. If anybody's talked to the media before, or if anybody's ever had some media training, you're taught that you have your talking points. And actually, it doesn't even matter what they ask you, actually. And that goes for the media, and it kind of goes for this too, to be honest. The question almost doesn't matter. What matters is that you deliver your talking points in an impactful, succinct manner. If you deliver your talking points well, that's all you want. And it doesn't even matter what you say, to be honest, as long as you're not saying something crazy. As if you have some reasonable talking points, the most important thing is that you deliver. It's the delivery of those talking points that matters. So you deliver it in a succinct manner that conveys the message that you want to give. And that's what they teach you in media training, actually. You just have your talking points and you're just ready to give out your talking points. By the time you're done your interview season, you almost feel like a politician. That's sort of how you should feel like. You should feel like a politician. They ask you your questions, you're smiling, you're pleasant, and you deliver your talking points. That is what is required here. It's not necessarily required that you give a quote unquote right answer. Does that make sense? Okay. So off to the left here is sort of the format of what you put on your piece of paper. All right. So I have my question, bullet point 1, 2, and 3, and then it says here, cap it off. You might wonder, what is that? What's that refer to? Does anybody remember from last year? Yes, Dr. Etoro. How do you cap off an answer when you deliver your talking points?
And that's why I believe I'll be a great fit for your program.
That's why I would be a great fit for your program. Okay, don't underestimate that, because remember what they're trying to answer. Are you a good fit for our program? So you can say any talking points you want, any reasonable talking points, but cap it off with, for these reasons, I believe I would be a great fit for your program. And it is fine to repeat yourself. You can say that for a few questions in a row even. And if you say that, subconsciously, they're looking for a great fit for the program. So if you're telling them, I would be a great fit for your program. So after they're done interviewing you, they may think, oh, you know what, this person might be a great fit for our program, because you actually said it. Okay. So that's how you cap off an answer. So you have your question, you have your 3 talking points, or it could be 2, or it could be 4, and then you cap it off. All right, you cap it off with, and that's why I believe I would be a great fit for your program. Do this format for each question, and it should look sort of like this. All right. This is kind of how it looks like on a piece of paper. You have your question, you have for each talking point, just like a few words or a few phrases, and then just something to indicate how you cap it off. All right. And this one pager, just study it. It does not take long. All right. And that is how you prep for an interview. And what's interesting is that after a couple interviews, you get really good at this, actually. And what's interesting is that you get good enough where somebody asks you a question that's not exactly on here, but you know what? You're nimble enough where you take a bullet point from here, 2 bullet points from here, put them together, and you've answered the question, actually. So that's why having these bullet points in your mind makes you prepared. Okay. All right. Good. Any questions about this before we practice? Okay. All right. Well, I tell you what, let's go through an exercise. Okay, this is tell me about yourself, but honestly, somebody think of a question. What question do we want to practice with? You know, I just practiced with somebody recently. Who was it? Was it Dr. Akin? Did I practice with you?
Yes.
It was with you. Okay,
Right.
good. Well, Dr. Akin, we've been through this. So,
Yes.
So, all right, somebody else. Let's practice with the question. Give us a question, somebody. What question do you want to prep for?
Why family medicine?
Why family medicine?
Or why specialty? I was going to say same thing. Yeah.
Sure, exactly. Why family medicine? Okay, who answered that? Who said why family medicine?
Me, Humera.
Dr. Humaira, very good. Dr. Humaira, we are going to think of 3 talking points, okay? All right. So now guys, when constructing your talking points, the number one goal when you are coming up with your talking points is not to answer the question necessarily. Okay, what you want to do is you want to highlight yourself. Okay, you want to highlight things about yourself. Does that make sense? You know, we're conditioned where we need to answer the question and give the right question. But remember, you're a politician here. And what you want to do is think, what do I want to highlight about myself? And I'm going to put that in my talking points. Okay. So Dr. Humaira, what do you want to highlight about yourself that we can put into the talking points here for this question? What do you want to highlight?
My experience working with the underserved as an assistant physician in Missouri. I really
Okay,
want to
guys,
put that in. Yeah.
Okay, so as an assistant physician, right?
Yes, that's right.
Okay, now guys, the other thing I want to emphasize is this. Do not one of the most common mistakes I see is that people underestimate the importance of being an assistant physician, okay? When they're interviewing you, they're determining if you're a good fit. Part of being a good fit is that you've taken care of patients before and they don't have to teach you how, I mean, they'll teach you how to take care of patients, but they don't want to teach you like the ABCs, okay? So like when you say, I am an assistant physician, I have done this and this, and I've done, you know, I've ordered labs and I've signed off on notes and I've ordered medications and done referrals. That's a big deal, okay? And especially when we're talking about family medicine. What I noticed that people, a lot of times, they hardly even mention being assistant physician in their personal statements or in prepping for interviews. And in my opinion, that's a mistake. You need to hit this home like crazy, okay? Like you need to mention this every opportunity you get, all right? Because this helps to distinguish you, all right? It helps to separate you from the rest, all right? So AP, good. What else, Dr. Humaira, do we want to say? I mean, underserved is good, but honestly, guys, they want to know that you're experienced, all right? That you're experienced with patient care. So, yeah, let's put underserved in here for now. Let's come back to it. Anything else, Dr. Humaira? What else do you want to highlight about yourself?
My internship back in India where I had served the rural population. Would that be a good idea to put in here?
For how many years did you do that for?
So that was a year of internship, but yes, my medical school where I did my training was in a deeply underserved area.
Okay, is that what you're looking to highlight about yourself?
I just was thinking to connect my rural experience in India and my passion for serving the underserved, and I'm working as an assistant physician, and that's why I like family medicine.
Very good. Now, okay. Now, anything else? Anything else that you want to highlight, excuse me, about yourself?
I cannot think of anything.
Okay. Well, what involvement with the specialty of family medicine have you had in the past?
So, I do have experience in all departments, I can say. Yes, peds, OB-GYN, as basically an inpatient rotation. Yeah, I do have experience with all those aspects.
Have you ever delivered a baby?
Yes, I have during my
Perfect.
internship.
Perfect. And this is why the one-on-one would be good. You know, the benefit of the one-on-one, there's some things that I'm not that useful for, but there's some things I may be useful for. One of the things that I'm useful for is I'm going to tell you what people like, okay? I'm going to tell you what people don't care about that much. The fact that you've delivered a baby before is big, okay? That's big. So, by the way, how many deliveries have you had?
I would say about 15 or 20 in a year.
Beautiful.
And yeah, I really am passionate about that. So I would really want to do that moving forward.
Look at that. You're passionate about it too? Oh my
Yes.
goodness. Well, yeah, we need to talk about that. So yeah. So again, part of the one-on-one when we sit down is I'm going to tell you what's good and what's not good. Okay. So underserved, don't get me wrong. Look, I love the underserved. I like my wife and I, we co-founded the Medina Clinic. Like, we're all about underserved. Like, don't get me wrong, I love it. But we're looking about why this specialty, which is a little bit of a different question. Underserved can be part of it, but like I wouldn't make it all about the underserved. What this needs to be, by the way, it needs to be like, what is it about you that makes you say, I am family medicine? Okay, underserved is a part of it, but I'm just from experience, it's not everything. So, but when you say women's health, and actually what you can say is, you can actually say, let's think about it. There's a lot of good stuff here, Dr. Homera, and that's the thing. Each of you guys, actually, that's why I enjoy your personal statements, to be honest, because everybody's story is very, very neat. It's very interesting. So everybody's story is very unique, and there's a lot of good stuff there. But what we want to do is to bring the good stuff out for the personal statement and also for the interview. Okay, so I think OB 20 deliveries. I just feel like that's a talking point, you know, deliveries. AP, absolutely. To be honest, Dr. Homera, look, I'm going to take some license here. I'm going to adjust this a little bit. AP, family medicine, all right? Because we're looking about why family medicine. The AP, dude, you are collaborating with a family physician, okay? Do you see what I mean? Like, you are collaborating with a family physician. So that's huge. That, like, why family medicine? I'm collaborating with a family physician. it's very, like, there we go, you know? So that, I think, is a talking point. Now, the underserved part, yeah. And so in India, you saw all ages, huh?
Yes.
Let me ask you, Dr. Humera, do you do any urgent care?
That's the only thing is probably missing.
No, it's not necessarily missing. No, it's okay. It's okay. But that's an easy one. So anybody
Yes.
that does urgent care, that's an easy one to go to. But so no, it's not necessarily missing or anything. No, it's just checking. So underserved, and then so in India, it was for an internship for a year, right?
Yes, that's right.
All right. And okay. So that is probably fine, but I just want to ask, is there anything else? Any other involvement with family medicine, such as, have you ever been to a family medicine conference?
Last year I did attend the virtual conference, the AFP conference, but not this year.
Oh, who cares? You went to an AFP conference? Good.
Yes.
That's what I'm talking about. That's what, oh goodness, what is wrong with this? Oh. So Dr. Homera, I want to take a little license here. I'm going to switch this out.
Go ahead. I'm giving you full license
Thank
for
you.
that, please.
And then AP. There you go. There. Now we're talking. Now we're talking. Okay. See, this is what matters, guys. So you went to the conference. This was for the residents and med students?
Yes, that's right.
Yeah, beautiful. So you went to the national conference. What did you learn from the national conference?
I basically got to meet all the residency programs, and I did attend the poster presentations. And yes, so that was the first conference that I attended, I would say.
What struck you about family medicine? What, like, I remember the first family medicine conference I went to, I was like, wow, these are really good people, like very good, well-meaning, like good-hearted people. Like, these are like the best people. I wish they were all, I wish the president of every country was a family physician. That's what occurred to me, actually, when I first went to a conference. What about you, Dr. Homera? What struck you about family physicians when you went?
That's
Or
a
about the
very good
specialty?
question.
Like, something
I
hit
would,
you, right? You got an impression, didn't you?
yes, that's right.
Think about it.
I'll be honest, there's nothing coming to my mind right now, but can you give me some suggestions?
I can. So let's think about it. So, you know, the AAFP, let's think about it. So you went to the national conference, so you saw residents and medical students. So what you can, maybe one thing that you can take from it is that, you know, like if I were you and I'm going and I'm seeing this for the first time, I suppose there could be a number of things, but you know what? Forget, let's not worry about what I think. What you other guys, what occurred, what was an impression that you got when you went to the national conference for the first time? What struck you? Because you know what, Dr. Homera, we're going to plagiarize. We're going to take things from your colleagues. So you guys, what struck you when you went to the conference for the first time?
So Dr. Marad, so I have been going to the conference for past 3 years now.
Mm-hmm.
A couple of in-person and one virtual.
Mm-hmm.
And what struck from the the AFP meeting was that, you know, they teach you, they have different sessions and the programs, you know, the timing, and in the first couple of days, first days, basically they teach you how do and don't, you know, like what to do and what not to do during the interview session.
Mm-hmm.
During the interview, and they tell you about their stories, how they became a family physician, and it's really interesting story you get to hear from them. And other thing that you get to meet program directors, faculties. That's the huge thing. I think I got it from the meeting.
Beautiful, beautiful. Okay, so if it's me and I am putting these talking points together, see, most of your time is actually spent putting together your talking points, to be honest. First thing I'm going to say is about the AP, actually. That's the first thing I'm going to say. And then the second thing may be maybe your love for OB. Okay, you do love OB, right, Dr. Romero? I'm just checking. You don't have to, but I'm just checking.
There's no doubt in that. I do.
Oh, good. I love OB too. In fact, I don't know, Dr. Homera, if I told you, I did an OB fellowship after residency.
Yes, so we did speak about that on
We
our
did?
first day.
Oh,
Yes.
oh, good, good. Yeah, yeah. So absolutely. In fact, I was on call just about a week ago or so. Actually, we had some deliveries and yeah. Oh, I love OB. It's my favorite thing in medicine. But I'm very glad I did it as a family physician. Actually, it's been gratifying in a number of ways. Anyways, okay. So I think these are some reasonable talking points, all right? So that's all I'm gonna write on my piece of paper, okay? And then, by the way, I need to cap it off. I think next year I need to get different slides. This is very silly. I don't know why it does this. Okay. All right, guys. So these are some reasonable talking points, all right? So now, we can practice delivering it. Okay, so if these are my talking points, why don't we practice delivering it? So Dr. Homera, why don't you ask me, let's pretend you're the interviewer and I am the interviewee, and you are asking me why family medicine, and let's pretend I'm you, okay? And I will practice giving you an answer based on these talking points. Does that sound good?
That's perfect. I would love to be on that side.
Okay, absolutely.
Being on the other side is really difficult.
Yeah, no, it's true, but you can do it. You can do it.
Sure.
You guys kind of jumped on a little bit after Dr. Lohani, Dr. Humera. I think you guys jumped on a little bit after. What the message that we shared at the outset of the presentation is that the interview there's a couple things. It's very high stakes. This is one of the most high stakes interviews you will have in your life. You have to do well. You must do well, okay? You have to hit a home run, basically. But the good news is that that is very doable, okay? So it is not hard necessarily to do well and to get a home run in these interviews, all right? It's very important you do well, but it is very doable to do well, all right? So just keep that in mind. Okay, so let's see. If I'm going to talk about an AP, I'm actually going to say that I thrived in this situation. And then love of OB, and then this is a specialty that can really foster my professional development. This is some, and then labor and delivery is something that I intend to continue. These are really my concepts. I thrived. It's really, I thrived as an AP is really what it is. I thrived as an AP, and then intend to continue OB, and then the national conference, that this is a specialty that will foster my professional development. So
also gives us an advocacy opportunities for our future APs.
now listen, guys, listen. Advocacy is great for future APs, but remember the points of answering these questions. You are trying to highlight yourself. When you say, this is actually a very important distinction, Dr. Lohani, I'm glad you brought it up. Try to avoid the talking point of, oh, family medicine is great because it can give you an opportunity for advocacy. That's true, but don't use it as a talking point. Who wants to tell me why? Who wants to tell me why?
You don't want to put the cart before the horse, kind of like.
I don't think you should be talking about yourself at this point, why you should be considered.
Yeah.
The program.
Guys, throughout your life, do not make things about you except this. This is all about you. Okay, so when I say, oh, family medicine is great, and family medicine, you can take care of patients from cradle to grave, and family medicine is so broad, those are all bad answers. The reason is because you're talking to a family physician. They already know this. You see what I mean? You're not teaching them anything. The purpose of the interview is not to talk about why family medicine is so great. They already know it's great. The question is, why should we accept you into family medicine? So that's why your answers need to be all about you. So if you do talk about advocacy, it needs to be on how you personally have advocated before. So if we look at these points right here, it's I was an AP, I did OB, I attended the national conference, I did these things. So remember, throughout your life, do not make things about you. You know how people humble brag sometimes? Anybody know what I'm talking about? Humble bragging, okay? Okay, humble bragging is bad, except here. Here, you humble brag, okay? During the interview, it is all about what you did. So don't talk about the specialty. We know about the specialty. It's wonderful. Yeah, we know. That's great. But that's not the point here. The point is not to tell your interviewer, who's already a family physician, telling them why family medicine is so great. Man, they already know that. The question is, why you? Why should I accept you into my specialty? Okay, that's the dynamic here. Okay, all right. So when it comes to professional development or even advocacy, you can say, I attended the national conference because I was inspired on how I can be an advocate for my patients. That's fine too. Okay, but it needs to be, I attended the national conference. Okay, so you humble brag essentially. Okay, guys. So Dr. Humaira, why don't you practice being the interviewer and ask me this question? I'll try and deliver these talking points on the fly.
Sure. So tell me, Dr. Murad, why do you want to go into family medicine?
Well, thank you so much for the question. I can tell you that as a licensed assistant physician volunteering in a charitable clinic while in a collaboration agreement with an attending family physician, I found that I truly thrived in that kind of environment, taking care of a broad range of patients. Also, I understand that as a family physician, I can develop my experience delivering babies, and that is something that I want to build on from my experience in India, having delivered over 20 babies during my internship year alone. Recently, I attended the AAFP National Conference where I was so inspired by the stories given by residents and attendings that really showed me that this specialty can foster my professional development. And for these reasons, I believe I would be a great fit for your program. And then done, and then stop talking, okay? Okay, guys? So that is how I would deliver that kind of question, okay? Guys want to do another one? Okay. What other, Dr. Humaira, what did you think? Dr. Humaira, did we lose you?
No, I'm here. I'm sorry. I was just speaking on
I
mute.
thought you were so,
No.
you were so appalled by the answer.
Oh, that's a wonderful answer, Dr. Murad. I'll tell you honestly.
Okay, so the goal is look in 60 seconds what you are able to share with your interviewer. You are a licensed assistant physician. You delivered babies. You attended the national conference and were inspired. You know that what's important is a good fit. You have indicated so many things in that 60 seconds that your interviewer will be very impressed. Okay, so so again, your bullet points need to be about you. Okay, guys, your bullet points need to be highlighting you. It is all about you. It's like when you're born, your wedding day, and your residency interview. It is all about you, okay? So it's one of the few times in your life where it is okay to just talk about you and what you have done, all right? Other than that, keep it under wraps because nobody cares, but this is one of those times, okay? All right, what's another question, you guys? Who else wants to give us a question? Well, I tell you what, let me put one on here that I think comes up a lot. What are your weaknesses? Okay. Now, here's the thing, guys. Does anybody here speak Spanish? Anybody here speak Spanish?
No.
Good. Put Spanish. Okay. I do not speak Spanish. Okay. All right. I do not speak Spanish. That's a weakness. That is a legitimate weakness. So when it comes to weaknesses, you don't put things like, yeah, sometimes I'm disinterested. Yeah, don't do that, okay? Or yeah, sometimes I'm late. No, don't. It needs to be some legitimate sort of, through no fault of your own necessarily, but from just like we all have our strengths and weaknesses, and it's fine. There's no problem. Like I don't speak Spanish. Is that a weakness? Yes, it is. Put it. All right. So, yes, Dr.
What about if you would say I don't have much experience in OB? Is that something?
No, I think like if you're coming from med school, nobody has experience in OB.
Okay.
Like, nobody does. Like who applying for residency has a lot of experience in OB, except an obstetrician. That's it. I mean, honestly, no, don't worry about it. Okay. So I mean, there's no such thing as somebody coming out of med school has a lot of experience in OB. They may have an interest in it, but do they have a lot of experience as a med student? I don't think so. So that's not even a weakness necessarily.
I'm saying that because the interview I had,
Yes.
I was asked if
yes,
I have inpatient hospital experience, and some, I've been out of med school. Well, I graduated in 2020 and I haven't matched. So they asked about my inpatient experience, and working in urgent care setting is not quite inpatient. So I was like, I don't have any inpatient experience except for my clinical rotation, which was all the way back in like 2018 or something like that.
Okay.
So I felt like that was a weakness, and I did not know how to kind of make it look like.
Right. So hospital experience, actually, that's a good one, actually. Hospital/inpatient experience. Okay, good. Let's put that. Anything else? Any other weaknesses anybody want to put? See, that's a legit one. That's a legitimate one. It's not like I'm lazy, okay? So that's a legit type, like, you know, so good. And honestly, we don't necessarily need to bombard them with our weaknesses. So 2 may be just fine, actually, you know? All right, guys. So let's do this. Now, okay, so you think of 2 legit weaknesses. You don't put your deepest, darkest secrets in here. You don't put anything about work ethic in here. Like, you don't, that's not what you do. But like things about lack of experience in something, that's reasonable. Now, the other part to weaknesses is you want to talk about what you do to overcome the weaknesses, okay? So I don't speak Spanish. Actually, yes. Dr. Gahendra, I think we did this one with you, right? Don't speak Spanish, or Dr. Akin?
Yes.
What did we say for this?
We did everything.
What did we say for, as far as overcoming not speaking Spanish? Like, what did we do? What did we do for that?
I said that I took some online classes.
Perfect.
On Coursera for the basic Spanish and Spanish for healthcare professionals.
Okay, perfect. Now, okay, that's perfect. Online classes, class for healthcare professionals. See, the important thing is that, you know, when you know your weaknesses, like if someone says, what is your weakness? And you know them quickly, people are like, wow, this is great. This person knows themselves. They know themselves very well. And you like that. You like it when someone knows themselves because then they can compensate for any weaknesses. So that is a sign of maturity. If someone, I don't know, does anybody see nowadays where someone says, no, I don't have any weaknesses? Does anybody ever see that still? So don't ever do that. That's horrible. Like, that's a joke. Like, really? No weaknesses? Like, yeah, no, that's a joke. So when you say, yes, here are my weaknesses that I am aware of. You know, people are like, wow, this person really understands themselves and they have a high level of maturity, okay? And then you are able to talk about your efforts to overcome or to address those weaknesses, and that shows also professionalism, okay? So online classes for healthcare professionals, good. And then hospital and inpatient experience. Acute care, Dr. Toro, what are some acute medical conditions you've cared for in urgent care?
Chest pain, shortness of breath.
Perfect.
Asthma.
Oh, excellent. Any heart failure by chance?
Not me personally, but others,
Okay.
Yes.
Others?
Also like trauma, broken fractures, dislocations.
Anything else?
And lacerations.
Sure.
Yeah.
Good. What about elderly patients coming in with stuff? Do you get any of that?
Yes.
Like, what do they come in with?
Most of them come in for medication refills, which is
okay. That's fine. Are they having symptoms?
Yeah, some like elevated blood pressure, elevated blood sugar. What else? GI.
Mm-hmm.
So nausea, vomiting, diarrhea. There's one that came in with altered mental status.
Okay, perfect. That's beautiful. Now, have you ever ordered IV fluids?
Yes.
Perfect. That's perfect. That's perfect. What other treatments have you ordered? Like nebulizer treatments?
Nebulizer treatments,
What else?
yes. What else? Ear lavage.
Okay, that's fine.
Um,
Have you ever given IV meds,
yes.
such as?
Zofran IV, like pain medication IV.
What about Lasix? Have you ever given IV Lasix?
Lasix. No, not Lasix.
It's okay. That's okay. Have you ever given IV steroids?
Yes, IV steroids.
Okay.
IM steroids.
Okay. Okay.
Yeah.
Perfect. Okay, good, good. Okay, excellent. See, this is inpatient care. Okay.
Okay.
Okay. So when someone says, well, you don't have hospital experience, you could say, actually, let me tell you specifically what I've done. So, good, good. So you've had people come to your urgent care with heart failure?
Yeah.
Good enough. Good enough. Heart failure. Oh, put heart failure number one, honestly. Again, this is where I might be useful because I can tell you what's good. I can tell you the good stuff. Like this is good stuff. Okay. All right. Good.
Sorry to cut you off, Dr. Mark. This is why I'm saying I wanted to be a little bit more specific because there's not much an OB experience here.
Who
So
cares?
that's why, okay.
Nobody cares. like, like I'm here to tell you, nobody cares.
Okay.
Nobody has good OB experience. Nobody. Okay. I do OB. I'm telling you, nobody's got good experience. I mean, you
Okay.
have residents who don't have experience. I mean, like it's not a thing. It's not a thing. I think when they're interviewing, what they know is that the med students who have just graduated, they have recent inpatient experience, okay? They've been on the floor during rounds, presenting, and part of the team taking care of acute inpatients, all right? That's what, like, they want somebody with that experience. So in this case, maybe you don't have that exact same experience, but you have something just as good. This is how you compensated for it. And this is actually being an AP, okay? All right, so Dr. Itoro, why don't you ask me, what are your weaknesses?
Okay. So Dr. Mart, what are your weaknesses?
Well, thank you so much for the question. I would point out two main weaknesses. Number one, I unfortunately am not fluent in Spanish. However, to overcome this, I have taken online classes for healthcare professionals to help equip me with patients that I know I will be taking care of in the future. Second, I have not had inpatient experience as part of my medical school rotations for the past few years. To compensate for this, I became licensed as an assistant physician in the state of Missouri, where I collaborate with a family physician, and this allowed me to independently practice in an urgent acute care setting. While there, our facility took care of patients with heart failure, chest pain, shortness of air, asthma exacerbations, fractures and dislocations, and lacerations, as well as symptomatic hypertension and symptomatic abnormal glucose levels, and other conditions such as gastroenteritis and altered mental status. I have experience treating patients with IV fluids, several IV medications, and nebulizer treatments, and have personally performed several laceration repairs. This experience, I feel, will help me overcome my lack of recent medical school inpatient experience. And this experience, I believe, will help make me a great fit for your program. Okay? That's what I would say.
Okay. All right.
Okay? So what you want to do is think of the weakness. And this is a good one, Dr. Itoro, because you touched on a weakness you know that they're going to ask about. So
Right.
that's a time where you can mention something you know that they're going to ask about, and then you can address it. Okay?
Okay.
So Dr. Toro, this one is for you.
Okay.
This is for you right here. So I would use that.
Okay.
Okay. And then again, don't forget to cap it off.
Yeah.
Okay?
I was wondering how you're gonna cap off weakness to make you a good fit. for
Yeah,
the program.
absolutely. Because you talk about what you do to overcome it. And whatever you do to overcome it is going to be phenomenal. And that's going to make you a great fit for the program. Okay.
Okay. All right.
All right, guys. You want to do one more? Again, the purpose of coming up with your talking points is to give succinct answers so that I don't ramble, but yet I say a lot about myself. Here, what did I say? I said, I don't speak Spanish, but I took classes to help make up for it. And also, I'm an AP. I took care of all of these things and did all of these things. So you're talking about you. Always talk about you, okay? All right, guys, let's do one more. Anybody got another one?
I do.
Okay. Oh, is this Dr. Otoro?
Yeah. Unless anyone else want to go. Okay. I was wondering if we could do one, why you interested in our program?
Okay.
Because I know you can find information about the program on their website, but
Yes.
the format that you have for us, I just want to see how we can.
Absolutely. Why our program? Okay. All right. Who's got an interview coming up? Don't be shy. Anybody?
Mine is in January, so it's not coming up yet.
It's in January. Okay. Where is it?
In Alabama.
It's in Alabama. Okay. Oh, what's the name of the facility by chance? Well, don't
In
worry.
Alabama?
Yeah, don't worry about it. It's okay. It's Alabama. All right. So, okay, the program, why our program? All right. It's in Alabama. So tell us, Dr. Gahendra, how big is this program?
It's actually a brand new program. So yeah, they just started this year.
Good. What else? What else about this program can you tell us? How big is it?
I don't know yet. I don't know how big it is.
Is it 12 people or 3 people? Is it closer to 12 or closer to 3?
Oh, you mean the residency?
Yes.
You mean the 6 residents.
Oh, that's not bad. It's not bad.
Yeah.
It's more like a medium size. Yeah. 6 slots. Okay, perfect. Good. What else can you tell us about this program? Is it rural? Do they specialize in anything?
It's more likely community-based.
Community-based, okay. Okay, good. All right, so those are 3 things. Now let's think about, whenever you're coming up with your talking points, you put a lot of thought into it, okay? Because remember, you're trying to highlight you. So, all right, and what specialty is it, by the way?
Family medicine.
It is family, okay. All right. Okay, all right, so let's think about this. Community-based, you can mention something about the AP there. It's medium, so AP teaching, community-based AP, family medicine. So it's a new program. Okay. AP independence. So if it were me, Dr. Gahendra, if I'm prepping for this, I would say, because it's a new program, new programs, they value being independent a lot. Like they don't have, new programs usually don't have a lot of faculty. So they need residents that are fairly independent. There's not a lot of faculty to do too much hand holding. So they value independence. So as an AP, you are independent. There are 6 slots. And that's a medium-sized program, so that would allow for a lot of teaching. As an AP, you were used to a lot of teaching because you checked out. You checked out to the preceptor and you discussed things with the preceptor. So you're used to good teaching, and a medium-sized program would allow for that attention. And then it's community-based. You're an AP. You practice in a community-based setting, and you thrived in a community setting. Okay, all right. So I think those are my 3 talking points. You see that all 3 are AP related. And I think that is how it should be, if you ask me. I think that's how it should be. I think you need to emphasize this as much as possible. If you mention being an AP once or twice, they may not get it. Okay, they may not understand. You really need to hammer this all the time. So yeah, if it's me, I would say you're an AP, so you're fairly independent, and you know that it's a new program. AP teaching, and it is a medium-sized program. And AP thrived actually, I think that was fine, actually. Community setting. Yeah, actually, I think that was fine the way it was.
How about any leadership experience? If we, include that, would that be helpful?
Yeah, I mean, leadership experience. Tell me more. What are you thinking?
I mean, since it's a new program, so we are going to be leading the coming residents in the future. So having previous leadership experience might help to lead the residency program.
I like it. So new program, independent, teaching, let's say AP, maybe instead of teaching, supervisory. So I think that's good. Yeah. Right, and this is also it also has to do with a new program. Yeah, I mean, you can clean this up, but yeah, I like it, Dr. Gahendra. I like it. So instead of leadership, I might say supervisory experience.
Okay.
Because that's what they will be thinking. So when you're a 2nd year or 3rd year, you're going to be able to supervise a junior colleague. So that's what's meaningful to them. If someone is a phenomenal leader and charismatic, that's lovely, but they don't care. But what they do care is that, oh, you can supervise junior residents? Oh, that's very useful. That they like, okay? So I like it. That's actually better. So, okay, Dr. Gahendra, why don't you practice, or why don't your experience, Dr. Gahendra, let me ask you the question. You can practice delivering this. What do you think?
I'm not ready yet.
You're not ready? Okay, Dr. Gahendra, we'll let you off the hook. Ask me and I'll practice the talking points.
Okay, sure. All right, Dr. Mora, why do you choose the OUT program?
Well, thank you so much for the question. I am very excited to apply to your excellent program. It is a new program, and I can tell you that as a licensed assistant physician, I have ample experience practicing independently in patient care in terms of seeing patients, completing documentation, ordering medications, labs, and referrals. And that independence is something that the program needs. Also, because it is a new program, I anticipate that you will have a need for residents to be able to supervise junior residents. As an assistant physician, it was my responsibility for new assistant physicians to train under me so that I can show them how to practice in our clinic. Also, your program is community-based, and as an assistant physician, I thrived in a community setting, seeing patients who more than 90% did not have health insurance and providing them with quality primary care. I believe that my experience as an assistant physician would be a great fit for your new and excellent program. And for that reason, I believe I would be a great fit. Okay, something like that, just something like that. I said this, I talked about independence. I talked about not only am I independent to take care of patients, I can supervise junior colleagues. And not only that, but I thrived in a community setting. You're a community setting. I did great in a community setting. So, you know, I can, so I would thrive in your program. So I would be a great fit. So in 60 seconds, you're able to say all of these things, okay? That's what I would say. So you see, when they say, why our program, you're talking about yourself and how, you know, you're connecting it with the program, but you're talking about yourself. Okay, what do you think, Dr. Gahendra? You look like you're thinking.
That's actually great. I'm thinking about how should I, you know, memorize this, you know, the sequence, and you know, that should be the great answer for that question.
Yeah, if it's me, I would refer back to this and I say, question number one, I just say, why our program? Bullet point number one, independence. Bullet point number, like independence. Bullet point number two, supervising. Bullet point number three, community setting. Cap it off. Like just those words, independence, supervising, community setting, cap it off. That's it. That's all I would write here. And I would study that. So I would say, okay, why our program? Okay, let me think. What are the 3 points for that program? It is independence, supervising, community setting. Got it. Okay. And you just, and then what you can, and what I would do, guys, is after I come up with this one pager, and like, look, for that question, why our program, you see, it's just like 3 words, each bullet point. And what I would do is I would just study it, just like you're studying for a test. You guys have all studied for tests before, right? So I would study this, and then I would practice. I would practice with myself. I'd practice in front of a mirror. If you have time, you can record yourself with your laptop, but just practice. Practice asking the question and then just delivering your points without looking at the paper. And honestly, it took just over an hour from beginning to end, like when I would do this, to be honest. So, so does that? How does that sound, Dr. Gahendra?
That sounds good.
Yeah.
Dr.
Yes.
Moran, how would you use the same point if the program wasn't new?
If it's not new, well, so think about, remember, always start off with what do you want to highlight about yourself? So can you think of a program? You don't have to say the name, but just tell me the characteristics of a program. Like think of a program and tell me what are the characteristics of it. Like easy ones is how big is it? How big is the program? Is it big? Is it small?
Let's say it's big.
It's big? Okay. Big.
Yeah.
Program. Okay.
Big program.
Okay. What else about the program? Is it community? Is it academic? Is it a mix? What is it?
Academic.
So it's on the campus of a university medical center.
Right.
Okay. That means that the name of the hospital is something University Medical Center.
Right.
Okay. Academic. Good. Okay, good. I like it. What else? Give me one more characteristic. Is it urban? Is it like, does it have a unique patient population? Like, are most of the patients underserved? Like, what's the deal?
Let's say it's urban.
Urban. Okay.
Yeah.
Okay. All right. Okay. Got it. Got it. All right. So, okay. So big program, AP, you're used to colleagues. You're used to like, you're used to a big class. Academic, AP, you presented.
Okay.
Urban, yeah. Anything else about it?
I can't think of.
I mean, does it have a good reputation? Is it well known? I mean, is there anything unique about the training? Is there anything they make a big deal out of? Like, oh, if you come here, you get trained in this, or anything about their faculty, or just wondering.
Maybe research opportunity.
Heck, you don't need to reinvent
It's
the
still
wheel.
academic, yeah.
Yeah, you don't need to reinvent the wheel.
Okay.
You can actually just use the same stuff,
Okay.
to be honest. You know, and even you can even hype up the fact that you're a chief. So good.
Can I add one more point?
Yeah.
I was wondering if you have an interview like in a local area where you're living, should you mention like location as one of the things that you like about the program, or would it look like you're just choosing this program for convenience?
Like if you're interviewing for someplace in Kansas City, then yeah, say you're an AP in Kansas City, like you have experience practicing in this area already. That's what I would do. You can see that I just link AP every chance I get, okay? Because they need to know what that means. Because what this will do is it will prompt them to ask, oh, tell me more. What is an assistant physician? What do you do? Oh, you actually prescribe? Oh, you actually do your own notes? Like it actually prompts them to be like, oh, I heard about this assistant physician thing. It's supposed to help people get into residency. Wow, that's what you're doing. That's great, So, like if you like the area, but sure, you can say, yeah, I've got family in the area, but I think it's more compelling if you say I practiced in the area.
Okay.
That's what I would do. Okay, let's just combine this stuff. So, so Dr. Ettore, we're gonna pretend that it's a big academic program in Kansas City. That's what we're gonna pretend, all right? Okay, guys, Dr. Ettore, if I ask you this question, you wanna practice giving off the answers?
I'm going to give it a try.
You ready?
Yes.
Okay, all right. So I tell you what, Dr. Ettore, just ask me, and then if you want, we can do after. So
Okay.
why don't you ask why this program?
Okay, so Dr. Morat, why did you choose our program?
Well, thank you so much for the question. I am very excited to apply to your program, which is a large academic institution here in the Kansas City area. Your program has a very large class, and as an assistant physician working as an independent clinician in a primary care setting, I am actually used to working with a lot of colleagues, and it is an environment that I thrived in. Also, because you are an academic institution, I understand the importance of presenting patients well, and that is something I did for every patient that I saw in terms of presenting the patient to my preceptor and discussing the plan of care. Also, in my role as a chief assistant physician, overseeing the performance and the schedules of my fellow assistant physicians, I know firsthand the importance of leadership and supervisory skills in an academic institution like yours, and I believe I can further develop my leadership skills. And as an institution and a program in the Kansas City area, I am so excited to apply to a program in the same city where I practiced as a licensed assistant physician. For these reasons, I believe I would be a great fit for your program. Okay.
All right.
That's what I would say if I can, okay?
Okay.
But to me, I just remember big class,
Mm-hmm.
AP, I presented patients, okay, chief experience, and yeah, you're in Kansas City. So that's where the location comes in. Dr. Rana, what do you think?
I think it sounds great.
Okay. Yeah, I think the location, like family is good. Family's fine, but I don't know. I just think it's more compelling. I volunteered. I mean, and even a better answer would be I volunteered in this city, you know, something of that sort. But that's your connection to this city, basically.
Okay.
That's what I would do. Okay, and you guys have your own unique personalities. You deliver it your own way, but I think these are reasonable points. So, okay, guys. So we went over 3 sample questions and bullet points of how to prepare. Again, the purpose of these bullet points is to give succinct answers. And these answers highlight you, okay? Like, why our program? You talked about your experience as an AP working with other APs, and your experience presenting patients as an AP, and your experience as in a supervisory role, and your experience in the city, okay? It's all about you. What you don't want to say is, oh, you're a big program, and I think that's great. You're an academic institution, and I think that's great. Oh, wow, I've got family here. I mean, come on. Okay, I mean, that's all okay, but remember, the purpose of your answers is to highlight things about you that you want them to know, okay? And you use you to answer the questions. You don't just say, wow, you're great. Family medicine is great. I love family medicine. It's like, okay, that's like nothing. That's not any kind of an answer. I mean, the question is, why you? What did you do? Okay, what experience do you have? So multiple things going on with these answers. You want to be succinct and deliver it well so that they're impressed with your delivery. You want to be succinct and to the point. So again, they're impressed with your delivery. You want to talk about you because they know that their program is great. They know that their specialty is great. They already know this stuff. You don't need to tell them you're great and your specialty is great. They already know that. The question, what they are trying to figure out in their minds is, why should we take you? So you need to talk about what you have done. So, you know, like just kind of similar when people humble brag, like, you know, they talk about themselves. And don't get me wrong, we all do that. I do that sometimes. I try not to. But the point is that, like, this is appropriate. I mean, you need to talk about you. And specifically, you need to talk about you being an AP. Okay. All right, guys. Shall we move on?
I had a question, Dr. Murad,
Yes.
if you don't mind me asking.
Please.
So it's just basically the non-verbal side regarding body language. Is it so? I've noticed you speaking. So I also intend to move my hands when I speak. I feel that's a way that shows my confidence. Is that a good thing or a bad thing?
So generally speaking, it's a good thing.
Okay.
I notice sometimes it's distracting for people.
Yes.
I think it's cultural.
Okay.
Personally, I think a lot of it is cultural. I know that, like, you know, I'm originally from Egypt. Egyptians use their hands a lot.
Same here.
Yeah.
Also, it's the same thing.
There you go. There you go. So I think I found that it works well. Okay. Once in a so the times where it doesn't work well is if I'm in an intimate conversation and I'm using my hands. That the kind is kind of out of place there, and it's kind of distracting.
Okay.
I think when if you ever talk to body language experts, they talk about appropriate use of the hands. You definitely use your hands, and they can be very effective. Whenever you're trying to make a point, body language experts will say, use your left hand to make a point. Like, I believe, here's my hand, I believe I would be a great fit for your program. Your left hand tends to be more impactful. I don't know, man. I mean, there's just some extra, but the point is that you use one hand. Use one hand to make a point. Whenever you're trying to make talk about something conciliatory or something about togetherness, or or even to express gratitude, a lot of times you'll take your hands and use them both together. Okay, so you say that I believe that I believe that family medicine can make an impact. You can use your one hand to say that. I believe, if you use two hands, you say, I believe in the importance of a team. Okay, then you can use like both hands. So I think in general, it's good to use your hands. I would maybe keep in mind those things to make a point and use one hand to say something conciliatory or something about togetherness, both hands, to express gratitude, like, thank you so much for your time. I am so grateful to have the opportunity to speak with you. That's both hands. Yeah, I think those are just some things I would keep in mind to help organize your hand gestures. How it looks on Zoom, I actually don't know, to be honest. Are you guys going to be doing Zoom interviews?
Yes.
Yeah. How it looks on Zoom, I don't know. My hunch. Well, what do you guys think? As far as you guys have done interviews before, so what's your experience with hand gestures on Zoom? What do you guys have to say?
I think it depends on your camera angle. If you're far away enough that your hand can show. If not, I tend to I'm not very expressive with my hands. I just tend to put my hand on the desk, and it kind of helps support my posture. And I don't know. I think it all depends on the camera angle, because you don't want to go out of the way to put your hands up. I think for me, it'll be distracting.
Yeah. Don't bring your hands up to your head, because anytime your hand comes up to your head, that's a sign of frustration, kind of. Yeah. You want to keep your hands to your chest. Don't take them up here. If you take them up here, I don't think that's good. Dr. Humaira, if that makes sense.
Yes, so what I use basically is my hands will be just lower. That won't be so high, but probably just as you speak, probably the same way. Yeah. I just feel more confident when I use my hands. That's what I feel. That's it.
Yeah, that's fine. No, I think that's fine. And if you use them unconsciously, then it's very spontaneous. It actually is good nonverbal communication, actually. But yeah, I would just keep in mind those things, like when to use both, make a point, and don't bring your hands up here. That's not good. I actually remember interviewing somebody, and I was asking her about so how do you deal with patients that are disruptive or that are unpleasant? And she made this gesture, and it didn't come off well. It was when patients are upset, it's boy, that generated quite a reaction in you, didn't it? So it says something. When people bring their hands up here, there's the emotion is I can't remember. It's frustration and almost giving up, kind of. It's there's the word escapes me. It's I forget, but it's like, oh, forget it, you know. It's kind of that emotion.
Is it like, do you mean despair? Despair or something?
Despair, yeah. Dr. Sartak. So absolutely, despair. That's exactly right. Yes, it's like it's that kind of an emotion, and it's too strong, and it's almost like a loss of control almost. So yeah, don't bring them up here. Use your hands. Use them naturally. You know, I think that's fine. But yeah, one hand, both hands, keep them at the chest. Don't bring it up here. I think that's fine. As far as, I would just be careful, Dr. Itoro, really focus on that posture, I think.
Yeah.
Yeah, like I wouldn't lean, to be honest. I would just sit nice and tall and smile and practice it. I would do that. Yeah. And you really, because you really need to show that you're like, you need to sit tall, kind of, you know, don't lean over. I want to do that. Sit nice and tall, like just your back's going to hurt for a little bit. I'm sorry. So I think it's worth it. It's
Right.
I mean, I'm not telling you hurt your back or anything, but you know, it's you know, just practice it. I think that's what I do. Now, I wouldn't lean. I would be careful. Even don't lean back on the chair. Even I wouldn't even do that. You know, you want to sit nice and tall. If you lean, I think leaning forward is okay, but you don't want to like leaning forward, but you don't want to like rest on something. I think you want a very formal appearance, sitting tall, straight up. I mean, that's really what you want. So,
All right.
yeah. So, okay. Well, good. Any other comments? Okay. All right. Okay, so here's some extra things. Always have questions. So whenever they ask you, do you have any questions? The answer is always what?
Yes.
Yes. There's no such thing as you don't have questions. If you don't have questions, it's like, what are you here for? You know, you're here because actually this is, as much as they're interviewing you, you're actually interviewing them too. Okay. So you always have questions. So have these questions. Look, I'll just share that, you know, whenever I interview, I always have the questions written out, and it is perfectly acceptable to whip it out and ask, or to open up your professional folder, because you guys will be, well, actually for Zoom you don't need a professional folder, do you? No, you don't. Yeah. Okay. So anyway,
In my opinion, I think you know, the advantage we can use to our benefit is that since we are on a computer screen, we can keep it minimized into a very small, like a note or something, like a Word document, and minimize it and keep it in the corner, so that if you want to kind of refer to it, you don't have to swipe between screens and and I did that myself in other interviews, non-residency related interviews. Okay. And for and of course you have to practice it, so you can use those questions as bullet points and expand it so that you're not actually reading it, because the interviewer will know that you're reading a question.
Yeah, Dr.
So
Sartak. Yeah.
I
That's a great point. You guys, you can have, you know, guys, I totally, so this just shows you how you could totally have your bullet points in front of you.
exactly.
Oh my God, you guys, you can have your bullet points. That's incredible.
So if Zoom is on the full screen mode, keep that on the full screen mode and everything. Just make sure that a small Word document to open and change the size of the window to something and keep it in the corner, and make sure that you have most of your questions in that little window part, and the questions are in a bullet point format so that they fit in that little part, and of course you have to practice all these things so that you expand the question when you ask it. That way, it's a two-pronged attack, that you also have it in front of you. You may not even look like you're reading off, and you absolutely don't want to look like you're actually written down an entire question and just reading it out like you're reading out a question. And if you practice this well, you can get this right. And this is where I believe that the electronic format, where where you can hide a few things behind the screen can be used to your benefit as compared to being face to face in front of an interviewer. So just my thoughts. And I use this in my professional level, in my administration job interviews as well, this kind of little trick. And this is common. This doesn't matter whether it's what kind of interview it is, you know. So.
Thank you so much, Dr. Sartak. That was phenomenal. Thank you so much.
I just wish it works for everyone, or even for some people. As I said, just practice this a little bit, and believe me, you will find your own sweet spot to master this little not trick, but little tip, I would say.
And Dr. Sartak, how do you suggest that you practice? So for someone who's like, you know, not computer savvy like myself, like how do you practice? You practice just turning on Zoom and minimizing it on the laptop, or how do you do that?
Yeah. So this Word document, or even Notepad document, that you type these 4 to 5 questions more in the form of bullet points rather than the whole question and actual grammatical sense, and then you make sure that you resize that entire thing to a very small thing that you can tuck in one of the corners of the screen, so that when the whole Zoom call comes in, that little thing is almost non-existent and it's over the head or the shoulder behind of the interviewer or whoever is on. So you're not obstructing them, you're not distracted much, you pull it in the corner. And as I said, it's a little subtle skill you'll have to learn to master, because we just spoke in the beginning that we have to even make eye contact even though we are through a screen. So you don't want to lose your eyesight with the camera point, like for example where I'm at. But if I keep that window right above where my camera is or something of that sort, in a little bit, it's not going to be too hard for you. And do this as a part of the thing, you know, your interview prep if you're doing with a friend or something of that sort, to make sure that you are able to fast multitask in your mind, reading and at the same time acting like you're actually coming it from your mind, not reading off a screen. It's a little bit of practice, and if I can do it, anyone can do it. Trust me, it's just a little bit of practice.
Wonderful. Thank you, Dr. Sartak. That was wonderful. Thank you so much.
I really wish somebody or anybody or everybody can benefit from this little trick of mine or tip of mine that I've tried in other interviews.
Absolutely. And so, guys, as far as the specific questions, I would suggest that that you tailor your questions to the person who is interviewing you. So, for the program director, you can consider asking questions like, "What are some recent changes to the curriculum? What is the direction that the program is going, in? Are there any recent changes to where the rotations are being conducted or held? Any changes in the facilities or the hospital sites? Things like accreditation. Is the program accredited? Are there any concerns about that?" Those are some sample questions you can ask a program director. So program director is in charge of the program overall. How many residents have dropped out in the past couple of years? What is your idea of an ideal resident? Things like that. And what the program director is really looking for is they're looking for someone who's not going to be a headache for them, who's not going to have disciplinary problems, someone who's not going to drop out, someone who's not going to need remediation, someone who's not going to be an administrative nightmare, basically. It's kind of what the program director is looking for. Faculty. Faculty wants someone who presents well, someone who's independent, someone that they can rely on for patient care. That's what faculty cares about. So you can ask faculty some specific questions like, what are some common pitfalls that you see in the interns? What are some study habits or reading habits that you would recommend for residents in your program? Now residents, they'll be interviewing you. You can, and what residents are interested in is this someone I can work with? Is this someone who I can get along with? Is this someone who is going to call sick at the last second? I'm going to have to cover for them. That's what residents care about. Questions for them would be, what is your experience as a resident here? Do you feel well supported? Do you feel like you have adequate supervision? Things like that. So keep in mind, whoever's interviewing you, they have specific things in mind, and you should have questions specifically tailored for their role. Okay. Any questions on that? Okay. And really, although
I do have
Oh, yes.
one more note, if I may.
Absolutely.
While we were I was explaining to create like a small Word document that you can pull in the corner of your screen. If you're not that tech savvy, if you don't want to haggle with that, good oldest of all, sticky pad. Stick it on the top of the corner of your laptop screen, and just make sure that it is just out of the way so that it doesn't distract you. But just when you need it, you can quickly glance at it for like 1 second. 1 second, your eye going away from the camera is not going to matter, I'm sure, to anybody. So
Right.
these are very little ways in which I have myself, when I was interviewing for my administrative healthcare administration jobs and all those things, I've used this, and I've done lots of interviews, so I'm kind of used to that. But once again, my only suggestion to all my friends and colleagues and co-candidates for residency is that practice it with your friends and colleagues, and you will get better at that. This is no, if I can do it, you can do it. It's nothing rocket science.
Excellent. Excellent. Thank you, sir. Okay, guys. So remember that everything is an interview. Okay, you need to always be on, always. And it's interesting because sometimes when you have lunch with the residents, they say, oh, guys, just relax, take your game face off, it's okay. Yeah, don't listen to that. Okay, you're always on. All right, you're always being interviewed. Okay, when you go to the pre-interview dinner, you are being interviewed. Okay, so always be on and ready. All right, definitely go to the pre-interview dinners. I think nowadays, do they still encourage bringing family to those?
It's all virtual. There's no dinner.
There's no
Everything
dinner?
is virtual.
Yeah, it's all virtual. We are doing it behind the screen in our rooms, so
That's probably better.
And what they do is between the main interviews with the 2 or 3 main people that you interview, they put in breakout sessions with groups of residents. Like 1 or 2 residents will be in breakout session with 4 or 5 candidates. So it's really not very. That is one place where even I feel that it's so odd how to communicate, and you don't want to talk over other, but at the same time you don't want to just be like, oh, wait, this person didn't speak at all. And these breakout sessions are unfortunately tricky. And if anyone has more pause, and they're not bad, we have to deal with it. But I do believe that we just have to learn to work with them until someday future, if at all we go back to in-person interviews. But if anybody has a more exciting or more creative or productive outcome or experience with a breakout session, please, I would love to hear. I'm sure everyone would love to hear.
Yeah. Does anybody have any tips on what's worked well for them for these?
I actually agree with Dr. Sartak. They can become a bit awkward because like you don't know what to say. They ask you like, how did your interview go with the previous interviewer? You just say, we have like a couple of minutes, and yeah, it can become awkward, but like I have no tips, to be honest.
Yeah, it's very interesting. How long is this for? Is it for like a half hour or?
Oh no, it's just like while they're like switching us between different interviewers. So like it's a couple of minutes.
Oh, okay.
Yeah.
And it could be more than one candidate with 1 or 2 residents. So as Dr. Rana also said, like it's kind of like, should I speak or should I let another colleague speak? And if I don't speak in the 3 minutes, will it be noticed that this guy just came and left without talking anything? Like you see her.
Yeah, that's
that I think is supposed to be a little bit more informal because it's with the resident. That's when you can ask them questions like, what do you do for fun? What's the area like? Ask them about, where do most residents live? Small talk. So I think, if you only have 3 minutes and you can't get anything in, then that's fine.
Sure, and once again, you completely agree. I completely agree with that, and that's what I'm saying. That you may not even. Unfortunately, I'm being very honest, and I'm genuinely not being critical about this because we'll go through this whenever we interview with how much ever we interview. That maybe 3 to 5 minutes. Yeah, if you get the chance, as Dr. Ettore said, have casual, friendly-ish conversation. But if you don't, I try to convince myself saying, hey, don't stress out. It's okay if you didn't get the chance to have the best ideal conversation as per you had wished. And just fingers crossed.
And I think some program, the residents will provide their email. And if you have extra information, questions you want to ask, then you can just email them. Some are really good about that. And I think some program as well, like maybe the day before, like a few days before your actual interview, they do like an open house, which is, I think, what is replacing these lunches and pre-interview dinners. So they do open house. You don't, come very casual. That's when you get to just ask them. I've seen some program do, you can bring dinner and eat while on Zoom. You can, do whatever. And they just talking about your experience, and they're trying to sell you the program before you actually go to the interview.
So, Dr. Murad, I also have this open meet and greet session before my interview with the residents. So, yeah, I don't know what to speak on that time because there's so many people during meet and greet sessions, and everybody's speaking at their own time. So I don't know what to speak and how to speak that time. Yeah, introduction part I will be able to give, but there are other things also. So I don't know.
Yeah. And that's during the breakout sessions on Zoom, right, Dr.
No, it's a 1 hour meet and greet sessions with the residents.
On Zoom?
Yeah, on Zoom.
And yeah.
That you'll find that usually have a lot of people, and I think some program might break it down depending on how soon your interview is coming up, or they just do everyone together. Like the one I went to, like had like 400 and something people, and that you don't really get to speak. It's just the faculty and the residents that are coming to talk about the program. So that cuts down some unnecessary time during the actual interview, where the program director just talks about the program in overall. So they're trying to like cut their time down. So they do the open house, they present the program to you, they just tell you what it's like. And they may take like, and some program, when you register for the open house, you get to write in your question, something you like to ask. And then from there, they have a list of questions that they can answer, And also in the chat, there are other residents in the Zoom call answering those questions. As you know, if you don't get to speak out, you can type in your questions and one of the residents will answer. So they try, but they don't always get to everyone. I don't think you should stress out if you don't get to say anything. Like I said, if you want to get in contact with a resident later, just ask them, can you provide a contact information? If I have further questions, I can ask you. Some of them are good about it. They say yes.
Yeah. The only other thing that comes to my mind is, I think whether it's situations like this, or even sometimes during like meetings, and it feels like there are opportunities where there really isn't, or it feels like these are times where there really isn't an opportunity to contribute that much verbally. And I think this is where nonverbal communication could be more important. Is
Right.
kind of the thing that comes to my mind. So I think that if I'm not talking, maybe I don't need to, but what I do need to is to make sure that I'm looking pleasant, I'm looking relaxed, I'm having my good posture, all the nonverbal communication that we talked about. I feel like that's the time to really make sure that I'm doing that well. And it's almost the same thing. Like sometimes you guys will go to meetings and there's really not much for you to say, but you say an awful lot by how you carry yourself. So if I'm slouched over and I'm like frowning and not paying attention, then people are like, I don't need to say anything. People already are getting a lot of negative communication from me. But if while people are talking, I have my good posture, I am smiling and have good eye contact, nodding. I'm nodding when other people are talking. That's very engaging, so that I make a good impression if somebody sees me, so that later you know, they'll be like, oh yeah, that person was really pleasant. As opposed to if I'm not engaged and I have negative nonverbal communication, people are like, oh yeah, I don't have a good impression of that person, you know? So that's the only thing that comes to my mind, to be honest. And I admit I don't have experience with this particular aspect. You can tell this slide is so like, this slide got to get rid of. Like it's totally out of date. I can't believe it. Like it's awfully out of date. It's terrible. So I
No
should
more
probably
dinners and lunches, Dr.
Al-
Murad.
Also, Dr. Murad, if the program re-invites you again, if you have interviewed with the program last year, and if they invited you again, does that mean they are interested in you?
What do you guys think about Dr. Lohani's question? What would you say?
I would say, yeah, they remember you enough to invite you again.
Maybe they regret not picking you.
Right?
So they invited you again.
Yeah.
That happened.
I think it's a good opportunity to make a good impression and probably the things you've done better over the past year. I
Yeah.
have a friend that I interviewed in a program and he didn't match the first time. The second time he interviewed in the program, they already knew him, so they were just like, oh, we know you already. The program director remembered almost everything he said the first time. It's really amazing how the man was like, yeah, I know you. I remember you said this then. So it's like, just tell me what has changed, you know? And he was able to add some of the new experiences gathered. He's done his step 3. I've done my step 3 now. Oh, that's good. That's good. Imagine the program. And that was the second time in the same program. So
Yeah, I like what Dr. Akin said, and in particular, what new have you done? And I think this is a prime opportunity to talk about your experience as an assistant physician. So you can say, since that time, I have been volunteering and working as an assistant physician where I have seen patients, done their notes, ordered their meds, done their referrals, participated in procedures, you know, followed them for follow-up, you know, and doing my inbox. I volunteer to do so. I present to my family physician attending. This is what, and I've been doing it, you know, at least monthly. You know, this is what I have been doing since the last appointment, and I've benefited so much and gotten so much great experience. You know, and they'll think, wow, you know, look at what you've done since last time. So.
I have a question, Dr. Murad, about post-interview communication.
Yes.
So, yes. So, I was wondering, after like you send a thank you email to the people who interviewed you, so they sometimes tell you like, yeah, like if you have any other questions, reach out to us. And yeah, so I was just wondering, like, if someone like reaches out with questions that they still have for the interview for the program, like how much is too much, like just to show like you're interested, that so they can remember you.
So good question. What do you guys have to say for Dr. Rana's question? What do you guys have to say about that?
I think
Dr.
don't overdo. Just send them a thank you email, and yeah, don't overdo. I think that's,
So nothing after a thank you email.
yeah. Just say like you're grateful that you got an interview and it was a nice, pleasant uh, experience for you, and looking forward to hear from them. That's it. Not more than that.
Now, Dr. Akin, you just had an interview, correct?
yes.
Tell us, Dr. Akin, how did it go, and how would you address Dr. Rana's question?
All right. So from the previous experience I had last year, the program I had interview with last year, they didn't even send us the name of the people that interviewed us. So it's kind of a subtle sign of they don't want communication with them. Not just to me, all the people that interviewed, they didn't give any information. So it was just now like a guess of I know the name of the program director, but I don't have the email. The email is not on the website. Some programs explicitly say on their website that they don't want any post-interview communication, that they will see you in the match and all of that. But some are not saying that expressly. So if they say it expressly, just leave them to, I've done my best. I hope they rank me. But if they don't say it expressly and they're not giving you emails, it's still kind of a subtle way of saying we don't want any students or any applicants to be bothering us with follow-up emails. However, the one I had last week, both of them, after the interview, they sent us the names of the people that interviewed us. They sent us a thank you email for coming for the interview, and they said please be free to reach out to the people that interviewed you if you have any questions. Now, I don't have any questions, but I sent email to say thank you. It was pleasure meeting you. I enjoyed this part of the conversation. I enjoyed the conversation with you. I was so much impressed with this particular thing. I tried to pick out one or two things that stood out in the conversation for each person so that they can remember at the point we had those parts of the conversation. And that was just what I did. So them sending email to me shows that they are willing to still connect with us after the interview. And that's what I did.
Okay.
Excellent.
Okay, thank you.
Good. Okay, guys. And I just wanted to share sleep well the night before. I just have to remember interviews now are by Zoom. So I take it that your interview days are not all day then, is that right? Wow.
4-5 hours thereabouts most of the time.
Yeah, okay. Well, nonetheless, sleep well the night before.
Absolutely.
Yeah, you want to be sharp. And sometimes, like, if I'm sleepy, then it's hard for me to be pleasant, and it's just not. Just make sure you're well rested. Don't stay up really late. Like, if you have to choose between prepping and sleeping, probably sleeping is better, to be honest. So make sure you prep ahead of time so that you can sleep well. Off the wall questions, honestly, I don't want to spend too much time on this. Let me just ask, for anybody, either this cycle or last cycle, did you get any bizarre questions, like really off the wall, weird questions?
Dr. Murad, I got lots of clinical questions from both the program directors. So be prepared for the clinical questions too, like how do you manage chest pain, woman's UTI, pancreatitis, PUD. Many questions I got related to ER or related to family medicine, related to ethics. So yeah, behavioral health.
And tell us, Dr. Lohani, what do you feel, do you have any tips for the group as far as how to address those questions?
So whatever we see in our clinics in day-to-day basis, and I was preparing for step 3, so I could answer those questions properly. But yeah, I think we have to read if we are out of your education. So read the AFP journals and try to keep yourself updated.
Okay.
Yeah, I had no problems answering those questions because it was all day to day, our cases, how we deal with our patients, just like that. Yeah.
Yeah, I like something that Dr. Lohani said, which is that, you can refer to what you've seen. So even if it's something that if you can refer to something that you've seen in clinic or seen clinically, maybe it's not the exact same thing, but you can say, like, I remember actually one time I was asked in residency, I remember one guy, he asked me, a patient comes in with hemoptysis. And what was it? Hemoptysis and lower extremity edema or something. And he was basically getting at it was a PE. So I said, well, I know that, during my rotations, what we would do is we would get a CT scan and we would get an ultrasound of the extremity and then start heparin drip. That's what I would do. That's what I have done or I have seen, in my experience as a student. Or so if you can refer to what you've done, so maybe if it's peptic ulcer disease, but you didn't exactly treat peptic ulcer disease, but you can say, well, in clinic, when patients present the symptoms, I would usually start off with a PPI. I would usually consider getting this imaging, or this is when I have thought about a referral. In other words, you talk about what you've done in similar situations, even if it's not exact, if it's something similar, this is what I have done in situations similar to this. And I think, and then, you know, I think it's just an opportunity to just, even if you don't answer the question, you show that you have been, you know, you've got good clinical experience, basically. So highlight what you have seen and what you have done, I think. So, Dr. Akin, you look tired. We need to wrap up for you, I think. So, okay, good. Has anybody got any weird questions? Like if you were a bird, what type of bird would you be? Or if you see a sign on the road, what does it make you think of, or anything like that? Anybody? Good. We don't have to waste time on that then. So if anybody's interested, we could talk about it later. But okay. So any last questions before we sign off?
Sorry,
Yeah.
Dr. Akin. One
Sorry,
more question.
Dr. Akin. we'll let you go.
I'm good.
Poor Dr.
I'm here with you. I'm here.
All right.
That's
So
good.
my question is on the thank you cards. If you're sending a card, I think there was one person that I know wanted to send a gift with the card. Do you send gift to program directors with the card? Would that be appropriate?
What kind of gift? Just curious.
Maybe like a box of chocolate or something.
No, I don't think so.
I think that's what they wanted to do. I'm like, don't send gift, just send the card. That's enough. If you're gonna like have something handwritten and send a thank you card, but a thank you email is probably most appropriate, but no gifts, right? No gifts.
No gifts. I don't think so.
I don't think so. That's highly unusual. Actually, it might be a red flag for some.
Yeah.
Yeah, would recommend against it.
Okay.
So, good question. Yeah. Okay, good. Any other questions? All right. So what I would encourage before your interview, if you guys have interviews coming up, now that we've done this session, I would recommend setting up an hour with me for like just an hour to talk about your specific prep. So for your questions that you're prepping for, what would be good talking points? And what I can do is I can share with you what's some good stuff and what's some stuff that's not that good, actually. So you can highlight the good stuff that will highlight, you know, what you've done and what experience you have. So I would suggest that so that you've got good talking points that you can prep for. So so yeah, please reach out to me. Please reach out to me to you know, you can text. I don't know if we have a chat here. We do. So here's my number. And just text. And that way, you know, we can just set up a time. It's usually about an hour, hour and a half, something in that area. So that, again, you can prep adequately for your interview, because you want to do everything you can to have a good outcome. So. All right, guys, anything else before we sign off? Okay, well, I really want to thank you guys for participating. I think all of you guys participated in a way that really made this session very, very valuable. You guys have a lot of insight on how interviews are conducted nowadays. And obviously that was very, very important. So the insight that you guys provided was amazing. So thank you so much for that. I really appreciate it.
Thank you.
Thank you for your time.
Thank you, Dr. Murad. Appreciate it.
Absolutely. You guys were wonderful to touch base with. And with that, everybody have a great night, and we'll talk soon.
Thank you. Bye.
Bye.
Good luck, you guys.
Good luck.
Bye, everyone.